providing statewide and national support for families and the systems that serve them. We're talking about TN Voices. The nonprofit is launching a new app aimed at helping to reach young people in Tennessee. TN Voices COO Will Voss joining us now. Good morning, Will.
Good morning.
Thanks for being here. We appreciate it. So tell us a little bit, I guess, about the background of why this application was important for y'all in the first place.
Yes, well, Tennessee Voices, we're a statewide nonprofit mental health agency working with all populations, all generations. Our goal is to figure out how is it that we can utilize a research-based tool and get it in the hands of children and youth, as we recognize that there's a need to continue to support them.
Right.
We've talked a lot, and statistics show 1 in 5 people have a mental health concern, and 1 in 6 of youth ages 6 to 17 suffer from a mental health disorder. So what is it that we can do to continue to combat the stigma against mental health and get people the help that they need, that they're looking for?
And it sounds like you're meeting these young people where they are as well. I mean, these phones are glued to their hands, and they're using apps all the time. So tell us what this app entails, like what all is on there.
Yes, so we partnered with telemedicine solutions to develop this app, My Health Coach Mind Power app. It can be downloaded in Apple stores, on the Google store as well. And our goal is to ask the questions of, well, are there factors that are playing into greater mental health concerns? Asking the questions around, you know, are you feeling down? Are you feeling depressed? Loss of interest? Things that could be a greater mental health concern. When we talk to youth about, well, we know we want to be physically well. We're focused on that. Can we also make sure that we're mentally well? And here's another way to do it. How can you let someone know that I'm not okay and it's okay to not be okay? How do we get it in the form of telehealth? How do we start pushing it out via the apps?
It seems like we're still, and it's so unfortunate, trying to get rid of that stigma. Is this one way that y'all are trying to address that as well?
This is one way that we are trying to address it, by letting us know, hey, here's another platform where you can tell us that you may not be okay, and on the flip side, well, actually, I'm okay today, but I did want to let you know that, and here are additional resources that we can provide, especially for those who may be screening and there are other health concerns, suicide risk, suicidality, depression, or anxiety that they need support in.
Okay, so we have the QR code that's up on the screen right now. Tell us a little bit more about how people can actually access the app.
Yes, you can download the app, My Health Coach, on the App Store or Google Store. And when you go into the app, you can utilize the code TNVPR23. Therefore, you can enter in your information and begin to take the screening questions and can get connected with a Tennessee Voices staff member who can help support.
It's awesome. Why this field for you? Why are you doing this as a living?
Yeah, for me, it was all about how do I combat the stigma on mental health. And as a kid, I remember always wanting to know why. Why do people think the way they do? Why do they act the way they do?
It's fascinating.
Yes, yes. And especially within the Black community, I always want to focus on how do we combat the stigma and say, you know, it's okay to not be okay, and mental health doesn't discriminate. It affects us all.
Awesome. Well, I'm so glad you came here and decided to talk with us, Will. We really appreciate your time.
Thank you all so much for having us.
Our pleasure. And folks, we're going to have more information about this application. There's a QR code. Again, just point your phone's camera there, and it'll send you to the link to download the app. Or you can check out our website, WKRN.com. We're going to have this entire segment posted under the Newsmaker tab.